Hello, I'm Dr. Bhushan Shitole, consultant orthopedic surgeon, robotic joint replacement, and sports medicine physician. Today, we'll talk about the most common problem, knee joint pain, and how to avoid surgeries for the chronic knee joint pain in elderly. Knee pain is one of the most common conditions which affect people of all ages, particularly more than 40 years. Many individuals who suffer from chronic knee pain, they fear of surgery and they think surgery is the only option, but it's not true. The good news is that in many cases, knee replacement can be delayed or can be avoided with the right measures. So let's talk about these measures where we can delay the knee replacement surgery. Knee replacement surgery is recommended when the joint is severely damaged, particularly if there is some underlying ailment like osteoarthritis, rheumatoid arthritis, severe cartilage damage because of trauma, chronic ligamentous injury, which generally disturb the dynamics of the joint. Long-term joint degeneration is very common in elderly. When the cartilage is completely gone and the bone hit on each other, is called as bone on bone disease. Knee replacement is generally avoided, but generally we tell them in very late degenerative condition. Knee degeneration starts slowly and it is divided in multiple phases. Most of the patient, when they start complaining of knee pain, they generally land up in very early or moderate osteoarthritis for which surgery is absolutely not needed. So, is there any alternative to knee surgery? Yes, there are multiple options we exercise before we asking for someone or before advising someone for the knee replacement surgery. What are they? We'll see that now. Most important thing is non-surgically physiotherapy and strengthening exercises. Generally, when the patient comes to my clinic and when he is having mild to moderate osteoarthritis, means there is still a gap and cushion for the bones to avoid rubbing on each other, where they fall in grade 1, 2, or 3 classification, we always aim for non-operative treatment. The most and foremost important thing is to train the muscles around the knee joint. It's called as physiotherapy. Now, the physiotherapists are the trained personnel, medical personnel who generally advises surgery. We focus more on exercises. The role of this muscle is to strengthen the joint and share the load with the joint. If we thoroughly do these exercises and consistently do it for a longer period of time, generally they have a very good outcome and probably knee is spared from its pressure and it halts the degeneration or maybe revert it back. Benefits include increase the mobility and stability of the joint, reduce pressure on the knee joint, better flexibility, and decrease pain during the activities. A physiotherapist generally guide this program, but most important thing is consistency. Consistency is the thing which leads to stability of the joint. Weight management, this is very underscored element, but very important. Every 1 kg you put on your body go through the joint. Just remember that. So even 1 kg less on your upper body should be 1 kg less going less to the joint. So very important thing, by any measures, by regular exercises, by diet. If you lose 5 to 10% of body weight, it significantly slow down the progression of the arthritis. Medication for pain relief, yes, they do have a small significance. Generally, we don't advise painkillers in elderly because they generally have less physiological tolerance for that. So yes, for short duration of time, maybe anti-inflammatories and joint supplements like glucosamine and chondroitin is helpful, but they are applicable only in early stage of degenerative disease. Knee braces and support, yes, knee braces are very important just to stabilize the joint initially and to support the weak ligaments. But the most important thing is if you keep on doing regular exercises, I think the braces will help you in that. But slowly we have to wean it off. Remember, no braces should be given completely and permanently. They improve the walking ability and reduce the joint pain while doing climbing stairs and standing and improves the posture of the joint. Injection therapies, yes, injection therapy is a good alternative, particularly in early to moderate degenerative joint disease. But the foremost important thing is that lubrication injection like hyaluronic acid and probably PRP injections or orthobiologics is coming age. But steroids, generally we should avoid taking in the joint because momentarily it gives relief, but long term it creates lots of accelerated degenerative changes. So yes, PRP, hyaluronic acid, and orthobiologic injections are important, and maybe stem cells and fat fraction cell therapies are showing good results in research. Lifestyle modification, very important thing is the way you sit, the way you stand is very important. Try to avoid sitting on low chairs, Indian commode seats, Indian toilet seats, and probably squatting. We generally advise elderly not to do that. Always sit on a high right chair where at least hip and knee level should come up. Try to avoid sitting on low right chairs that put extra strain while getting up. Choose low impact exercises, swimming, cycling, they are very good, but avoid running and jumping. Generally, we ask for that. So, maintaining lifestyle, yes, there is a very important role for this to avoid any surgery. Regenerative orthopedic treatment, this is a coming age and highly researched alternative. We are having promising results like stem cell therapy, PRP, advanced cartilage restoration technique. This therapy are the latest alternative for the knee replacement, which are getting explored worldwide, and probably in due course of time we'll have a concrete solution in terms of early or moderate degenerative joint disease. So how to avoid knee replacement in future? Prevention is very important. Maintain good healthy body weight, stay physically active, strengthen the muscles around the knee joint, particularly quadriceps, hamstrings, avoid long high impact activities like jumping, treat knee injuries early, consult an orthopedic surgeon on time, and early diagnosis and proper treatment of small ailments of ligaments and muscles around the knee can be very important and prevent the progression of the joint damage. When knee replacement is needed, it is only needed when bone touch each other. It's called as bone on bone disease. In a very advanced condition of severe arthritis, we need a knee replacement. When the pain is persistent and severe, there is a night pain, even walking few steps are difficult. For them to do daily routine activity is troublesome, and joint damage is very advanced. An experienced orthopedic specialist can carry on these techniques. But yes, knee replacement surgery is for selected few. Majority of the patients who having the symptoms of joint disease or joint pain, generally we can manage very well. Majority of them with non-operative treatment. If you want to explore and have more knowledge about this, you can contact on my website drbhushanshitole.com and contact me in person, ping me in person.